This is Dan coming for LogiPharma, and today I am joined by Frederico from Pfizer. Good afternoon.
Hi, how are you?
I'm very good, thank you. Thank you so much for joining us.
Thank you.
Of course, you were here yesterday taking care of a presentation alongside your colleague Manuel, and you were discussing theoretically leveraging segmented distribution in order to deliver innovative options for internal customers. But that isn't actually exactly what you spoke about in the end.
No, actually not. That was a long title, so we kind of shortened the title and increased the scope. So we talked about Pfizer's supply chain and network transformation over the past few years, and what are we doing to leverage segmentation to satisfy customer needs.
Well, obviously segmentation, massive topic for pretty much all industries that deal with logistics, deal with segmentation now in some way or another. What exactly was the process? Where were you when you started the project? Where are you now, and where are you planning to go?
Right, so Pfizer has been transforming the supply chain for many years, starting with manufacturing network transformation, supply chain process transformation, in-market logistics and supply chain transformation. So we have been running transformational agendas for a long time. The situation we're in now, like many pharma companies, is that we're going through a major business model change. So we're seeing a lot of loss of exclusivity products. We're seeing tremendous growth in emerging markets. We're seeing increased complexity and increased cost pressures. So we had to think differently and leverage all the transformation efforts we have done to date. So what we have done is to establish a product-oriented organization to deliver globally orchestrated products and globally designed product supply chains. We're in the journey to implement that full model, and we're in the journey to also leverage our existing systems platform. And that's what we explained. Yesterday.
That sounds like an extremely large undertaking. It sounds almost like you have to change virtually the entire business to make it work.
Yeah, I mean, as I said, it's a multi-year journey. We're in this product-oriented step of the transformation. We were quite successful last year establishing new processes, new organizations, new roles and responsibilities. We identified quite significant value already. And now we are in the next step, which is really connecting all the supply chain nodes, manufacturing plants, transportation, in-country operations to really behave like a globally orchestrated network.
So is this something that has a finite deadline and an end point, or is this one of those sort of continuous projects that will constantly develop as needs change? Right,
so that's an interesting question, because everyone thinks, well, this is a one-year project or a two-year project. You know, everyone that talks about transformation thinks of a finite project. For us, it's a mindset. So we are working very intensively. We have very short-term milestones and deliverables. We have to deliver value. But at the same time, we're going through a massive change. I mean, our network is quite complex. We have over 50 plants globally, 58 actually. We have over 300 external suppliers, 35,000 SKUs. So changing this massive company doesn't happen overnight. So we will have a continued effort to transform, but with very set in time milestones to achieve it.
So what are some of the key challenges in that transformation?
Yeah, I think right now the next step in the journey is really leveraging the system platform we have. We have a very wide implementation of planning tools, SAP, ERP tools. We're leveraging that infrastructure, and we're setting up a new way of managing global products. People is used to manage regionally, locally, you know, in their site or in their country or in their function. And what we're establishing is a new mindset to manage end-to-end products, not operations by site or by function. So our next challenge really is to leverage the system, enable orchestration to happen in a true basis, end-to-end, top-down, up, bottom-up, and then change the mindset for the company to really cater to customer needs and to product needs.
I mean, end-to-end supply chain has just been one of the key topics of the entire event today.
Right.
And obviously Pfizer is no different.
Right.
So are there actually any major physical changes you have to make to the business, or is it pretty much a purely operational project and sort of a restructuring?
When you mean physical changes, you mean infrastructure, plants? Keep in mind, Pfizer has been restructuring the network for many years.
Right.
So we come from many integrations. We integrated great companies into Pfizer, right? So over time, we have been restructuring our supply network. We constantly do that. This transformation is about what do you do on top of transforming the physical asset. Even if it's changing plants, how do you keep managing the orchestrated supply chain, even if the players change? If we outsource an operation, how do you keep that orchestration going? If we change a transportation company, how do we keep this orchestration going and this product view going? So it's almost like an asset-independent, or let's say node-independent orchestration that we want to achieve. We want to be device-independent, we say.
So what kind of benefits are we likely to see, particularly if you consider the end user, if we can really define the customer? I know that in itself has been a major talking point.
That's a great question, which I forgot to answer, right? Not all the customers need the same, not all the businesses need the same. We have several different business units. The products are behaving very differently in parts of the world. So what we're achieving by doing this is to be able to leverage a segmented service to the customer and to the patient. In some cases, we need cost-effective supply chains. In some cases, we need highly agile supply chains. And in some cases, we need a mix of those elements, right? Or we need service, agility, or cost, one of those three. So really what this model does is to enable us to customize that service for that business unit or that country or even that patient eventually.
Fantastic. Well, thank you very much for speaking with us. Absolutely fascinating stuff. And of course, best of luck with the project.
Thank you.
Cheers.